Mr. Governor was very clear about his mission in this dispensation. And so we went about building a resilience into Lagos right from the beginning. We told Mr. Governor that, COVID has emerged in some part of the world. And he said, well, you must do everything possible to ensure the safety and protection of the citizens of Lagos, and of course, most importantly, to maintain their livelihoods and economic stability. So while we were managing COVID on the one hand in our specialized units that we put together, Mr. Governor actually said, make sure that people can still seek their health the way they're normally accustomed to seeking health, either in the public sector or in the private sector, without any impediment. We've spent the last 3 years under the supervision of Mr. Governor to develop this blueprint. It's brand new, it's modern, it's utilized local and international designers and architects that know about health sector, developing a modern, iconic spectrum of buildings that are in keeping with the way modern medicine is evolving, but more importantly, are in keeping with the climate change agenda. So we're building our hospitals to be naturally cooled, to pay attention to the sun, to the wind, to the way the sun moves, to the way patients and staff will move through the hospital, to keep it naturally cooled, to have renewable energy as a significant component of these buildings. So all that is being developed, and we've reached the end of our blueprint, which means that we can now start to roll out these modern buildings, both at the primary healthcare level, the secondary, and the specialist facilities. So that's on one part, and Mr. Governor has made sure that we have access to enough resources. We have up to 40 general hospitals. We have 300 primary healthcare facilities. We have a teaching hospital. We have some specialist centers. We have a very elaborate ambulance service. So we're trying to modernize what already exists. So we're going into many of these hospitals like Lagos Island General Hospital, Harvey, Isolo, Ebute Metta, Mainland Hospital, where we keep all our biosecurity patients. If you go there now, you will actually not believe what you're seeing, because it's gone through a complete infrastructural transformation. So we're building the new Massey Street Hospital out of the blueprint. This is going to be the biggest children's hospital in Nigeria, if not West Africa. We're building a new general hospital in Ojo to create a gap between Alimosho and Badagry. We're building the biggest psychiatric facility in Africa, 500-bed psychiatric hospital with 1,500 rehabilitation center. We're now building the biggest infectious disease research institute in Nigeria. It's going to be at the IDH in Mainland Hospital to make sure that Mr. Governor is in a position to be on top of any emerging outbreak or threat or biological threat that comes our way. Modern medicine is expensive, so we've brought in the Lagos State Health Insurance Scheme, which we are promoting across Lagos. It's called Ilera Eco. We are gaining ground. A lot of people are beginning to get confident in the Ilera Eco program. The federal government has just ensured that health insurance is mandatory for all its citizens, which is helping us in Lagos. And Mr. Governor is emphatic that we should drive the Lagos State Health Insurance Program to ensure that every Lagosian is carrying a health insurance card, which means that you can go to any of our facilities, both public and private, and seek health, with a card, and not necessarily putting money down before you get the health that you require. So it's a very exciting time to be working under the leadership of Mr. Governor. He's very proactive. He's very involved, he's dynamic, he's open to ideas, he's collaborative, he's supportive, he has your back all the time. So he's a great governor. It's a lot of fun under the circumstances. A lot of work, but it's a lot of fun. My name is Akin Abayomi. I'm Commissioner for Health for Lagos State. I'm proud to be a member of Mr. Babajide Sanwo-Olu's cabinet.